Good evening. Good evening for Leti particularly. Thank you very much for joining us in today's webinar. One more webinar in the series of initiatives for interagency training within the framework of a GF tax that is delivered to all of you in all countries of Latin America and the Caribbean to prepare for and prevent, as well as respond to African swine fever and other transboundary diseases. Thank you very much and welcome everyone. This is the fourth webinar in a series of webinars that focused on risk communication. Today, we are inaugurating the stage of crisis communication, and then we will be closing the communication stage with the next webinar in April 25th, with zoosanitary education. My name is Erika Calderon, and I work for the Inter-American Institute for Cooperation on Agriculture, and I am in charge of coordinating this interagency group made up of CAFSA, OMSA, or the WOHA, FAO, CAN, CVP, the USDA, OIRSA, COPEC, and we meet on a regular basis in order to prepare on an ongoing basis to respond to the emergency of African swine fever. There is a platform where all of these webinars are being recorded to address several aspects regarding African swine fever and other transboundary diseases. You will find all important information developed by all of these institutions. Today, we will be having excellent conferences in the hands of, first of all, Leticia Lin. Leticia Lin will be discussing certain aspects of risk communication. Dr. Mati Perez, who will be discussing the experience of the Dominican Republic in risk communication. Dr. Sylvia Kreindel. The presentation is called No to the Escape of African Swine Fever from the Dominican Republic, No to the Transportation of Salami or byproducts of pork. Pigs Don't Fly, and also Alonso Stefani from OIRSA. And as you can see, we will be discussing several experiences regarding crisis communication. I would like to invite you all to enjoy these wonderful presentations and also encourage you to ask questions through the chat. After all of these presentations, we will have a space for questions and answers where everyone will have the opportunity to, after you have written your questions, we will convey them to the panel of experts. Please also write on the chat what institution you belong to, because it is very important for us to monitor the participation and the attendance to these webinars. These webinars are being broadcasted not only on Zoom, but also on social media, and they are being translated into all 4 languages, and French, English, and Portuguese. Let me first give the floor to Leticia. Let me just give you a brief bio of Leticia. Leticia is a consultant in communication for the World Health Organization in the Europe Regional Office. For almost 1 decade, she was an advisor for media and communication in the regional office of the Pan American Health Organization in Washington. And she is part of the network of communicators in health for WHO. a case of emergencies, and she was posted in Liberia during the outbreak of Ebola. Leticia was a focal point for communication of PAHO in response to chikungunya, Ebola, Zika, and COVID-19, among other emergencies in the region. She has a master's in social communication from the Catholic University of Uruguay and a master's in journalism on public affairs from the University of Maryland in the United States. Before PAHO, she worked as a communicator in the Rapporteur's Office for Freedom of Expression of the Inter-American Commission of Human Rights, and she was a journalist and a foreign correspondent for more than 1 decade. Since 2021, Leticia lives with her family in Bonn, in Germany, and she is joining us from Germany today. So thank you, Leticia. Thank you for your commitment. And we can kick off the presentation. Thank you very much, Erica, and thank you very much, everyone, for being on the other side, connected, and joining us and following this presentation of different ideas and tools regarding crisis communication. I think it is a very positive thing to see how, from the point of view of animal health, this is one of the main topics, and it is also a lesson learned for other sectors because you are, in a way, using a crisis to continue to build trust and to prepare for crises that may come in the future. The only certainty we have is that there will be more crises. In any case, I cannot really assist you in terms of animal health because my main scope of work has been and is crisis at the level, at political and institutional levels when I worked for the Rapporteur's Office for Freedom of Expression. So over the past decade, I've gained experience in the topics of public health in the region of the Americas. As you probably remember, we have had several of these crises, and in the countries that you represent, you have been the witnesses of many of these public health crises. And you probably remember several of them because it affected us significantly. And of course, the mother of all the crises, the pandemic that has affected us as well. So many of these aspects have been covered, but being prepared for all the other crises, we were more prepared for the COVID-19 pandemic. Today, my goal is to go over certain concepts of crisis communication and tools to address them within the scope of public health. And this, of course, according to WHO guidelines. You probably will be able to tell me how you can apply these tools in the area of animal health. Then we will discuss questions and answers during the space assigned for that, as Erica described. I think that's the uh, richer part of any webinar, the part where questions can be answered. Why communicate in a crisis? So what is our goal when we are communicating in the middle of the battle? Yes, when the outbreak is already a reality. The first thing we want to do is intervene in the behavior of people who need to change a specific behavior in order to put a stop to an outbreak. This applies to public health and also to animal health. You probably have a target audience that you need to pay attention to a specific behavior. And this can lead to maybe an outbreak extending. Yes, that's why you need them to change behavior, or maybe to prevent them, you need this target audience to engage in a series of measures. So that is why communicating is an intervention in itself. So we are trying to involve the people that we need to take action. We need to have an impact on their behavior. And many times we need to maybe correct wrongful information, or maybe we want to deal with rumors or address them. And we want to, of course, protect our credibility as a public institution. So what is the value of information during a crisis? An effective communication is actually a practical tool and an operational need as well. However, the value of information during a crisis carries a lot of weight, not just from an external perspective. So not just when we are communicating to audiences outside our institution. It is also extremely important to deal with internal communication during a crisis, because if we cannot have a good internal communication on what is happening, what we're communicating, what we know, what we don't know, internally, we can start having a lot of noise. And as a result, we will not be providing or showing a coordinating approach as an institution, and that will generate even more problems in our communicational response to that crisis. So an aspect that many times is not seen very clearly when we deal with crisis communication is to maintain internal order, to keep everyone informed internally, have clear messages and why messages are what they are. In order to have effective external communication as well as internal communication, we need to be able to plan for a crisis. This may seem contradictory, but it is not. I remember that we had trainings for emergencies a while back before I started participating in the network for public health emergency communicators organized by the WHO a few years ago. And I remember how shocking it was to think that we didn't really need to be reactive when there was a crisis. Up to that moment, I had experienced crisis as something that just happened to you, fell on your lap, and that you had to just, come up with solutions on the go. And at that time, risk communication was not fully developed within the scope of public health. So at that point, I thought, okay, I can plan what to do in the face of these situations. And to start really thinking about the fact that one could determine who will deal with each thing could really change the mentality of any organization so that there is no improvisation when there is a crisis. These are some of the truths that we need to have in mind. Crisis and communication on crisis is inevitable. Crises are inevitable, and we will have the mother of all crises, such as a 3-year pandemic as we had, or we will have a small outbreak that maybe affects a small community in the agricultural sector, say, or in the fish farmer sector. So it can be something very small, or it can be something really large that completely changes the game in terms of how we work. This is why it is very important to plan ahead. Transparency and honesty is essential when communicating a crisis. Lies have a short life, yes. So transparency and honesty when we are dealing with responses to critical moments where the lives of people are being affected, or the lives of farmers that depend on a certain resource. When we have to make them change their habits very quickly, we need to be fully transparent and honest. And the culture of an organization can also contribute their grain of salt so that things, go in one way or another. So we need to pay full attention to what is happening in our institutions. And let me just give you an example. If you have one spokesperson who says one thing and someone who says something else, who does a farmer believe? Yes, the person who lives in the countryside and maybe believes one person, but the culture involves really determining and being consistent in our messages. So there's a golden standard when in doubt. If you were the target audience, well, first you define the target audience. And if you were the target audience, what would you want to know? What would you need to know? And these might not be the same, yes? How would you like to be told this information? screaming in writing, door to door? Would you like to hear it from a friend? Would you like to hear it from the president? How would you like to find out if you were the target audience? And then what channels would you need to have if you had more questions? Yes, if you were this target audience, because oftentimes in communication, we do an exercise that consists of imagining the person, yes, giving them a color of hair, a color of their eyes, everything, to really turn them into a real person. And then we put ourselves in that person's shoes. And that helps us think of how we can provide effective messages using the adequate channels that we need to reach that specific target audience, and also address the different perceptions and what we need them to know and what they actually want to know. Like I said, these might not be exactly the same. And then always have a spokesperson that can respond to the media and to all questions. Sometimes it's not even questions from the media. Sometimes, I don't know, there's an assembly of neighbors, an assembly of farmers, a group of mayors from small towns, for example. Something that is convincing for the different environments. We do obviously prepare for the media, but these spokespersons need to be able to talk to different audiences in times of crisis. When we talk about risk communication and we talk about prepared spokespeople, we always think of the media immediately. And this, of course, is important. But when it comes to animal health, first, you need to have a prepared spokesperson that can talk to other groups. And the media, comes maybe afterwards. So it's not just preparing a person to face the cameras or the clicks. Yes, it's someone prepared to deal with a group of farmers who is angry, etc. Some myths in crisis communication, for example, communication during a crisis is purely reactive. You may be experiencing a crisis now, but you can also plan what you're going to do each step of the way. I am being redundant, but it's a concept that needs to be fully conveyed, because having those plans results in other initiatives and other responses. I remember when I was studying journalism in the master's program, we had a writer who had won many Pulitzer Prizes, and he said that his success was that once a month he gathered all of the journalists together. He took them out of their daily routine. They sat around a table in a room, and I said, what is the worst piece of news that we would ever have to face? Yes, not that there was bad news at the time, but everybody said that there was a nuclear plant nearby, and they had all thought of a plan of how they would cover the news if this nuclear plant, caught fire or there was an incident in the nuclear plant. So they had a plan for the worst case scenario. That emergency never took place, but once there was a leak in the nuclear plant, and they activated the same protocol that they had considered. So that's why they won a Pulitzer, because based on that planning, they were able to obtain good ideas to do their work on a daily basis, to cover differently and to work significantly. My point is that sometimes those communication plans regarding crisis result in good ideas for a campaign, maybe for a mini campaign even. So crisis communication is not purely reactive. In communication during crisis, you only deal with the media. This is another myth. And like I said, sometimes we need to deal with angry people in the neighborhood, in the town, with unions, with powerful associations as well. And you will maybe say in the chat who you deal with during a crisis. I want to hear from you in the chat. Maybe with health workers, people who work in rural areas who have no access to health, and we're asking them to do something and they don't know why.
The work of communicators is to revert from negative to positive communication. Sometimes we need to just say what's going on, and sometimes that is a negative thing, and that's the way it is. And we don't need to revert something. Well, we need to capture their attention, get their attention, and do and to have people do what we need them to do with the information that we have at the time. We're managing expectations, uncertainties, and we're handling and dealing with many different humors at the same time. And we cannot control the whole of the situation, because the essence of a crisis is that there is uncertainty and the fact that it will change and fluctuate. Just like I was saying, in a crisis, you only need to communicate with external audiences. I've said this before, but internal audiences are very important in terms of institution, at the institutional and interinstitutional level. The executive and legislative branches need to know what's going on. Different groups, unions, everyone needs to know what's going on up to a certain point. And then the other myth is crisis communication is linear. That's a myth. It's not linear. It's a constant headache until the crisis is over. And when the crisis is over, you take a deep breath and you start thinking about the next crisis. How do we communicate crisis? Well, first of all, you prepare for crisis. Then you identify the audiences. That's very important, because you will have a very large map for that kind of audience. If you're already thinking what your potential crises are, then you can start preparing messages way before crises happen, because then you take it and adapt it to the situation. So you have a baseline to start with, and then you can adapt it. You need to have clear, mapped media outlets and channels to disseminate the information. Are we talking about flyers, brochures? Are we talking about TV or radio spots? Which is the best channel to your audience, and when? Well, you can all map that beforehand. In times of peace, in times of crisis, you know, just to get everything together and see what's more effective, and then actually respond to internal and external feedback. That is, assess how your response is doing, how you're communicated in a crisis. Are we doing what we need to do, or is this a crisis and we need to start from scratch? Where is the noise in the communication? Where do we need to see and tailor our messages? And that is what it says there about assess success or not. What is the plan to communicate in a crisis? Well, it's vital, because it organizes the way we're going to communicate. It forces us to make decisions before the crisis. Who's going to be my spokesperson? If that person doesn't work, who's going to be the deputy spokesperson? How am I going to get clearance for all of my talking points? If Ezequiel is going to the remote people's assemblies, who will be dealing with the producers associations and the unions? You know, it tells us how we're going to do things, but also who is responsible of each stage. Of course, plans may change, but we have a starting point when we have a crisis. A bomb explodes and we don't start from scratch. We have certain clear ideas, and we have made up our minds before the pressure is put on us. It allows us to have clear goals in terms of what we want to do and the tools and processes that we will be using. We need to remember something. Noah didn't build the ark in a day. He built it before the flood, right? Before the storm. And that's us, pretty much, or we should be like Noah, preparing our arks before the flood comes in. This is when the risk and crisis communication guideline principles are useful. For us in public health, communicating risk is quite similar to communicating crisis. What has progressed for now is going beyond the first announcement. For many years, the only thing that was planned was the first announcement, and then there were noise in the communication and we didn't have anything planned. But thanks to all of the crises that we've endured in recent years, we have organized that. So the first thing is to build and maintain the trust during the crisis, the importance of an early announcement, the importance of transparency, the importance of listening to our different audiences, and the importance of planning. You're going to leave this seminar saying, I am so dense when it comes to planning, and I'm sorry, but that's true. How are we going to build, maintain, or restore trust? When there's a crisis, what generally happens first is that our target audience will have their lives change. Perhaps not so much, perhaps a lot. And the first thing that people do is resist change. So the first thing that we need to do is to have that target audience, the group of people whose life will be affected or has already been affected by the crisis, and we need them to do something to change that situation. Well, they need to trust us. They need to trust what we're telling them to do. And that trust, and if that group trusts what we have to tell them, they will be a little less anxious every time we switch gears and courses. They will be less anxious in terms of the situation, and that will bring the pressure down for us. And trust toward the institutions that are organizing response needs to be created before a crisis. You can give me specific examples in animal health cases, but if there was a situation where you started building a relationship with a certain community, it is very likely that they and you will want to feed into that relationship, because if something affects that group in particular, then you already have a relationship and your trust. Now, how do we communicate trust? Well, first of all, if you're undertaking to do something, do it. If you cannot commit to doing something, then don't say that. Don't promise things that you won't comply with. How can I put this nicely? This is a basic issue in any kind of response. You cannot ask people to do something that they cannot do, that compromises their economic incomes, that they compromises their health. And if you want to ask something for people to do, it must be something that they can actually do. Also, if you say that you're going to do something, do it however you can. If you say you're going to give them resources, money, help, assistance, I don't know, water, do it however you can. If you cannot do it, then don't promise them that you will do that. You can say, we'd like to do this, we're trying to find a way to do this, but do not promise them that you'll do something that you won't be able to do. Sometimes you will not be the best spokespersons for these kind of things. Sometimes they won't believe just you. Sometimes you need to resort to the academia. Sometimes you need to talk to mayors or neighbors, other producers, other farmers, the unions. Sometimes other people, other parties will be better spokespersons than you and will help you convey the message. You need to show that you're professionals, competent, ethical. You need to be empathetic with people. If you know that what you're asking these people, this target audience, if you're asking them to do something that is hard for them to do, then you cannot be ordering them around. You need to be empathetic. You need to find a way to say the message that you want to say in a way that acknowledges the sacrifice. You need to acknowledge that this is a sacrifice, that there is a respect and a concern about their situation. People will be fearful. If I could tell you the number of times in public health that this has happened, well, I'd never finish. And fear is not a great response. If you tell someone, do not be afraid, I don't know if you have children, but if you tell a child to not be afraid, they will still be afraid. That's not the way. And the same thing goes for adults. If you say, don't be afraid, people will be more afraid. I'll start thinking about Freddy Krueger or stuff like that. So accept the fact that people may be fearful, may be afraid. Do not try to erase that fear. Just try to find a way to handle that fear best without disregarding it or diminishing it, because then people will lose trust in terms of those who are handling the response. Do not exaggerate or minimize risk, and if you make a mistake, because it might happen, of course, if you make a mistake, just say so and correct it quickly. And then use those moments to give people a specific thing to do. That is, you can address the situation from this way. If you do this, if you do that, that is what we're asking of you. People are always much more comfortable during a crisis if they know what they have to do. Early announcement or early notification in terms of crisis and risk communication is very fundamental in terms of the messages. It is the thing that you tell everyone first. We're in a globalized world and everyone knows everything. Everyone knows things about your neighborhood, and I know things that are going on in China or Japan or Australia. Then everything we need to understand that everything is known. We need to give an early announcement as soon as possible, so that gives you as an institution the ability to be, or the possibility to be respected and trusted, so that you will be telling people what is going on. It avoids rumors, it avoids the spread of misinformation, it shows who's the leader in terms of the response. And what we always say in terms of risk communication is that if you don't know something, you need to admit that. Responses change. It is an ongoing situation. In every disease or outbreak in the region, we don't always have all the answers. And always very clearly let people know that things will be changing. And as soon as they change, you will be explaining them those things and sharing the information with them. Transparency, that's one of the other guiding principles. You need to let people know how decisions are made, how are they confirmed, why you're doing what you're doing, how you reach that conclusion. And the explanation of the process is the transparency in the way you make decisions creates more trust. It is complicated, of course, because sometimes you'd like to just skip the rationale behind it. But even if it's painful or if it's a pain, you need to do it so that you build trust with the audience. And next, you need to listen to the concerns and the needs of the population. You cannot design a successful communication message if you do not know how the target audience thinks and feels. As I said at the beginning, you should stop for a second and say, if I am this person, this target audience, what do I know? What do I need to know? What are my concerns and my fears? And sometimes you might just get there and say, and I'll be very generic here, just kill all your chickens. How can I kill all my chickens? What about my livelihood? These are my chickens. I love my chickens. So how do we handle that situation? Well, this can be annoying. You can be thinking, oh my God, these people. Well, they are the ones that have to change the behavior, and they have a set of values that we need to understand and decode to see what is the best way to persuade them to change their attitude. So working with the community, and if possible, before the crisis, is fundamental, because there's a cultural, social, and economic context that will condition the way we work and the way they behave. So understanding the people in their context is much more important than just sending information. You can send all the flyers that you want with every detail in terms of African swine fever. But if you don't convey that message in a way that it connects to the people, it resonates with them, and so that they can see a way out of it, then it will be pointless. If you send a flyer, an announcement, a radio spot, or any kind of communication, and you don't see a change in the way people behave, then you need to review what's going on and what is it that they're not hearing or listening to. That's why you need to listen to the target audience or a target population's needs, and based on that, take action. As I was saying here, there's an importance of the community to which we are addressing. If we're preparing the materials, are you considering the language, the community, the local groups, the local leaders? Sometimes you need to identify the leaders of those small communities and talk to them, because that will be useful to persuade the rest of the community to do what we need them to do. What are the coordination mechanisms with social or local networks? And it's important to map them from the beginning, so you know who you need to go to when a crisis comes up. Sometimes the answer is not just one community, but several communities, different private sectors, and civil society organizations, and we need to map that beforehand. I was saying, the kind of community, the channels, the language. What is the best way to get there? Do I do a door-to-door campaign? Do I need to go to weekly or monthly community meetings to talk to them? Do I need to talk to the leader of the group or the tribe? Who do I need to address? Who do I need to talk to? Do I need to talk to the neighbors? Who are people listening to? Well, who are their leaders? And all of this, should we have a crisis or a conflict, will help us develop the best or most accepted procedures or processes to see how we can, apologies, to see what is the response for that community. To listen to the concerns and needs of the population, we need to get information from the different audiences to analyze their concerns and needs and to include them in your message, as I said before, to monitor and assess whether people are actually responding to what you're saying. You need to plan communication, something new, right? I've never talked about planning communication before, right? Communication, as I said, is integral to and core to planning, whether that means adapting and identifying the different plans and audiences and partners who can talk on your behalf in a specific situation. What are the channels that are best to share your information? How are you going to do this internally? Are you going to be sending a letter? Are you going to have an assembly? How do you let the rest of the ministries or institutes know about what you're dealing with and how you're dealing with it? How are you going to be having a unified message? It's very likely that many people within an organization have to set a meeting with farmers or producers, and they will be asking you about this crisis. They will want to know if you're ready to face those concerns. Do you have talking points? Do you have key unified messages to give them? What can make our life complex? This is a long list. It's just some cultural differences. For example, in the Ebola situation, there were a lot of problems in Western Africa when it came to burying people. You know, people were constantly touching the dead bodies and they had their own rituals and then they got the disease. You know, we could think about the cultural differences in terms of animal health. You can think about them. There might be myths and rumors sent throughout WhatsApp audio files or videos. You know, now this is essential to consider. Sometimes it involves other sectors and it gets complicated because it is not so easy to consolidate communication because every sector has its own interest. And of course, as I said, every group has their own interests that might be undermining our response and communication. You might unwillingly stigmatize a group with your message. You need to be careful about that. There might be local national elections, or there might be social unrest that might complicate the response. Then what might happen is that the relationship with the national or local animal health authorities is not great, and then response will be much more complicated. But we can have that considered beforehand in a plan. This is a list of things that you need to consider when you're trying to develop effective messages in the context of a crisis, like how to explain the risk, the context, considering the system of beliefs and values and the risk perception of every audience. I'm not even going to go into the risk perception because I know that you have seen this in other previous workshops. You need to take care of and try not to use jargon or slang, because sometimes we bombard people with lots of technical vocabulary and people will not understand that and they might misinterpret that, or even worse, they might actually ignore it. Be careful about speculation. Sometimes we tend to say, well, if this happens, then right. And it's not an appropriate way of handling a response. If you're trying to provide a crisis communication, then speculation might be understood as a commitment, as a reality, and that can undermine your response. Try not to promise results or resources that go beyond your possibilities. And that is essential. If you say something to people that you will give them something and you don't give it to them, it will be hard to come back from that. And of course, beware of sensitivities, laughing about a farmer killing their chicken. Well, I'm exaggerating, of course, right? This is not an example. But sometimes what I mean is that some situation might seem funny to some, but it might be dramatic for other people. And people are having a hard time and they will be offended by it.
So how to develop these messages during an emergency? Sometimes at the WHO, we develop these sorts of tests, and these messages need to pass this test. So are the messages easily understood? This is how you avoid jargon and technical language. Are the messages complete, honest, and open? Do they recognize what is not known and they do not speculate? Are these messages respectful of the concerns of their audiences? Yes. Do they worry about their livelihood, justice, future? I mean, do they take into account these messages? Are these messages sensitive to cultural practices? And are they sensitive to what these people are going through? And how do audiences analyze a message during a crisis? How do they assess? Were they timely? Were they given to me by a reliable source? And are they being honest with me? Veracious information and the speediness to release the information. This generates credibility and trust, and that is the formula for successful communication during a crisis. And to be honest, is part of the formula, but success cannot be measured until much later, much after the crisis. That's when you will be able to see all the things that you were able to avoid. These are some of the lessons learned uh, at the level of public health. This, of course, in different crises that we've had to undergo. The chikungunya crisis in the Americas was a new disease, and there was a risk of having a saturation of the health system. And I know that the Dominican Republic will be presenting today, but the DR had a very serious outbreak of chikungunya. And one of the main problems was that people did not believe that it was the mosquito that transmitted the disease because it was so different from other diseases transmitted by mosquitoes that they could not believe this. Another dilemma was that people were trying to, they were trying to tell people what chikungunya was, but the fact that the treatment was just, for the symptoms. The pain and the impact was so high, was so severe that many people did go to a hospital anyway. And the problem is that the curve went up very, very quickly, and the health services, health systems were saturated. So throughout the different stages, for the different audiences, many different rumors had to be managed regarding the transmissions, fight against conspiracy theories, etc. Ebola was another very clear case in Western Africa in 2014. I was posted in Liberia back then, and when I went, nobody believed that Ebola was true. They thought it was malaria, they thought it was something else. But with time, what happened was that the messages from the ministry were so strong regarding not really caring for the sick person and leave, yes, not treat them, and they were ask. That's what they asked of people, but people could not do this. They would not leave a sick person in their family behind, so they stayed by their side. People quickly realized that it was a disease, and that's when health services were saturated, and there was no way to respond accordingly. Response was not adequate back then. So after many months, things changed, but there was a change of perception in terms of Ebola back then. Uh, Up until that moment, it was just small outbreaks in different countries. This was the main outbreak in 2014. The Zika virus in the Americas, what nobody knew is that it could cause the effects that it did in the newborns, yes, microcephalia and other syndromes. So there was a series of problems associated which changed the response. And then in 2020, the mother of all crises, the COVID-19 pandemic that really challenged everything in terms of a response, in terms of risk communication, because I think no one expected the world to stop for as long as it did. So this created a great deal of uncertainty, lots of rumors, and this was a crisis that had a profound economic and social and political impact. And we are still seeing how to recover. I'm running out of breath because I'm going very quickly. So in conclusion, before Erica kicks me out, first and foremost, be the first to communicate during a crisis. Provide recommendations that are simple and easy to understand so that your target audience is actually reached. Coordinate with all of the sectors involved, all the stakeholders. Listen to the concerns and needs of the people that you are targeting when drafting your messages. Do not talk to yourselves or do not talk to experts. If you have someone that you're talking to or that you're addressing, think of what that person needs to know and take into account the risk perception of these audiences. You're asking of them to do something, but you have to understand how they measure it. Remember that successful communication requires veracious and timely information, empathy, transparency, credibility, and trust. With this, I give back the floor to Erica. Thank you. Excellent presentation. Thank you. So timely also, because we all think that crisis communication is reactive, but it is not. Everything has to be planned. And so that is why we have these webinars, because countries should be adequately prepared in times of peace. In the Dominican Republic and in Haiti, they had to do risk communication at the time of the event. And that is why we encourage countries that haven't had a crisis to develop an adequate plan for a time of crisis. Thank you, Letty. We do thank you. If you can stay for the questions and answers, I'm sure there will be plenty of questions. And also remind you that we do have the chat so that you can place your questions there. And we will be reading the questions from the Q&A. We would also like to thank every person who has joined this webinar. Today, we have Delvin Mesa from IPSA in Nicaragua. We have Yolanda Capdevila. We have Julian Zulueta from Cuba. We have Karina Sanchez from Senasa, Peru. We have Colbert Dowan, who is the CBO from Guyana, uh, from Guamal, also in Colombia, and the ICA in Colombia. Dr. Perez from the Ministry of Wellbeing and Health from Jamaica, and Jutiepec, Morelos, Mexico, and others from Ecuador. In these webinars, we've had the participation of public and private sectors, and this is what we want to do is to reach a very wide audience because these are topics that involve us all. So we encourage you to disseminate these webinars, to share them. They take place on a monthly basis. So share this with associations, with academia, with ministries of agriculture, as well as ministries of environment, health ministries, etc. So we encourage you to share these webinars so that people can continue to participate, people can continue to prepare. And at the end of the webinar, we will be placing the link here uh, for you to access the platform that we have developed together with all of these agencies that I've described before. As I said before, this is an interagency effort. We have Katia Martinez representing the WOHA. We have WOAH, sorry, and we also have a group. Um, like I said, this is an interagency effort, and this is really unprecedented because we are consolidating all of the information so that it can be accessed in one single place. Thank you, Leti. Let us move on to the next presentation. The next presentation will be given by Dr. Mati Perez. Dr. Mati Perez will be discussing her experience in the Dominican Republic for crisis communication in African swine fever. And let me describe her background. She's Dominican. She was born in Santo Domingo. She studied veterinary medicine in the National University, and she studied at the Kibbutz Shefajin in Israel to manage the raising and nutrition of cattle. She is in charge of technical dissemination of the Animal Health Division in the National Office of Livestock. And for more than 10 years, she's been the focal point in the face of the WOAH. In the area of crisis management, she has worked managing a group of veterinary experts, and she is also the secretary of Association of Fellows from Israel in the Dominican Republic. She is assistant to the technical director of the National Association of Livestock Farmers and a secretary at other organizations. So without further ado, doctor, you have the floor. Thank you very much. Thank you very much for inviting me to participate today and to discuss our experience in communication of crisis in the case of ASF in the Dominican Republic. The presence of the ASF virus occurred after 1 year of the COVID-19 pandemic, and also with a new government structure because we had a new government in power here. Before this, we were doing passive surveillance for ASF and also CSF, where we took samples to confirm diagnosis, and this was confirmed in the United States. Through this project, we identified the first provinces, more or less. This is the timeline of the event. June 24th, we started receiving the first notifications of diseases, swine diseases. The technical team started taking samples in the field, and we were suspecting that this wasn't classical swine fever as we thought at first. By July 17th, we started conducting our initial investigation, and the notification took place on July 7th, and then the investigation started on the follow-up investigation started on July 22nd. Then we confirmed the diagnosis on Plum Island, and then after that, Uh, we confirmed the presence of the disease in the country. On July 26, 2021, at the ministry, we had held a press round to bring calm to the different audiences. There were already comments about the presence of the disease. At the time, we conveyed the fact that we were investigating, but that pork could be eaten without a problem. We were trying to avoid a collapse in production. On Tuesday, July 27, we presented the first actions to deal with the possibility of the presence of the disease. We informed that the SOCO had to be conducted and to determine who the official spokesperson would be. At the Department of Agriculture in the Dominican Republic, there was a first posting on social media, and obviously this spread like fire in the provinces, and it even led us to having to quickly activate all of the government structure in order to face everything that was associated with this diagnosis. In the swine industry, as well as in government services for animal health, we had to come together really to address the situation. The postings on social media regarding the presence of the virus in the Dominican Republic was something that really was essential in the news, and the National Directorate of Livestock issued a communique where they informed and notified everyone officially of the presence of the virus. We immediately started to take actions. As the previous speaker said, and it is really not the same to be prepared to take actions than to have to react in the middle of a crisis. Like I said before, um, the country was exiting a pandemic and starting a new government. And the budget, of the government had already been spent because it was 8 months in. So we had a very limited budget. Of course, there's always an emergency fund that had to be accessed in this case. The president right away took actions, and we started implementing these actions. One of the first ones was to create a hotline for people to be able to call for free, a toll-free number where more than 50 operators were trained in order to respond to the audience, because unfortunately, we had in the press some journalists that were misinforming more than informing, because they even said that this was another pandemic, that this disease would jump to humans, that it would cause you to die if you ate the contaminated meat. So obviously we had to address this as well. At the same time, and they were available also to communicate this to a cell phone number 24/7. We started training extensionists as well that worked with livestock farmers and who provided support and training so that backyard farmers could also be trained, because specialists in animal health were focusing on taking samples and they could not really be dealing with other aspects. We started speaking on the radio and uh, television as well. We appeared there. We had an official spokesperson, the Minister of Agriculture in this case, and we also started developing infographics and other printed material. I have to thank the international organizations who supported us from day one, such as OIRSA. It was one of the first organizations that supported us. And we started posting on social media to try to educate our citizens on the disease. We particularly focused on a campaign on Instagram and Facebook to also strengthen trust in the products. Yes, the power of art and communication helped us create these postings that were posted on Facebook and Instagram, and thanks to this, tensions were a bit released. Consumption was not affected because people trusted the products. We also started working on training in crisis communications at the level of the country. We are divided in 8 regions, and we did trainings on each region for all veterinarians.
As I said, these are the first materials that we started to disseminate, and those were the ones donated by the Regional International Organization for Plant Protection and Animal Health. These are security or safety materials. This is a brochure that we started circulating nationally among all of the production sectors, organized and backyard farms in terms of African swine fever. With the RIOPA, we also circulated new materials. These are the most recent ones. We put them in airports and ports in November before the Christmas holidays, because we know that Christmas holidays bring a lot of transit of and transportation of swine products. We wanted to protect our commercial partners, and the idea was to just contain the virus within the country. We also had communication materials that were facilitated by the WOH-AH. We started putting them throughout our borders, in ports, airports. We placed the banners in veterinarian shops, in food factories. Those you can see were printed as posters and signs, so that we delivered them to different shops because we needed to target different audiences. We needed to talk to everyone who had a part in the production chain. By 2022, last year, we created a ministerial resolution that was passed, creating the incidents command system in order to define a unit responsible of directing policies and strategies in terms of prevention and control of ASF. After creating that command system, we continue to work in communication actions, and we started working and promoting the canine pairs that have been extremely important as tools to help us detect ASF and swine products in ports. We also have these communication materials that were printed and circulated by TRASA, TRASA. This was invaluable work by TRASA because these posters were not only placed in veterinarian product shops, but also we had a staff of promotion or extension workers who were talking to every person who went into those stores or shops, providing them with information on the disease and how they were supposed to notify the disease, particularly, which is one of the most important things that we needed to clarify. We have campaigned on promoting the case notification. By the end of last year, we started working on a campaign, a communication campaign throughout the media, the radio, printed media, WhatsApp chat groups, in order to strengthen the message so that we would be supported in the work actions that we were going to be taking. We needed to understand the population to implement the new animal health strategies that we needed to implement and supplement when it comes to the advance of the disease. The whole of the communication campaign was carried out based on the progress of the disease in the country. That is why we created some radio messages and soundtracks, carried out the message as well through the rural populations that were focused on the productive area of the country. This was not only a support to a message to the swine product producers, but we wanted to promote the notification of cases. I cannot help but thank all the entities that have helped us throughout all this time. We've had immediate response from RIOPA, from APHIS, TRASA, Programa programs, and the USDA, of course, the FAO, and we need to thank everyone who provided us response in terms of emergency safety, biosafety. Of course, we need to thank the WOAH as well and ICA. They've supported us both economically and in other ways so that we could print our material and distribute it throughout our country. This is it for me. Thank you very much for listening to me, and I'm open to any questions you may have. Thank you so much, Dr. Mati. It was a very interesting presentation, and it is admirable the quick response that the Dominican Republic has implemented and the response from the different international entities that immediately assisted you technically in this situation. So, let's move on to the next presentation, which will be given by Dr. Sylvia Crandall from USDA APHIS. Dr. Sylvia Crandall. She is the on-scene incident commander for the U.S. African swine fever response for the U.S. Department of Agriculture, Animal and Plant Health Inspection Service, APHIS, in Santo Domingo, Dominican Republic. Her responsibilities relate to all aspects of the ASF response, including development of incident objectives and overall management of the incident. In her previous position, Dr. Crandall worked as the APHIS director for China and Mongolia. In this capacity, she managed one of the most important APHIS portfolios on agricultural and livestock market issues. Sylvia comes from the Food and Agriculture Organization of the United Nations, the FAO. She worked there as the Animal Health Division USDA Veterinary Services loan expert on risk analysis and epidemiology. In that capacity, she provided epidemiological analysis on suspect and confirmed outbreaks of transboundary animal diseases and other high-impact diseases of uncertain nature and their impact on food security and food safety. Dr. Crandall has worked extensively throughout Latin America, Africa, Asia, and the Middle East. During her time at FAO, she led several initiatives for the control of transboundary animal diseases, including the Global Early Warning System, GLUES. She published several TADISC risk assessments, including the evaluation of the presence of new foot and mouth disease serotypes in the African and Asian region, avian influenza, H5N8 in Europe and Uganda, H5N1 in Middle East, tilapia virus in Africa, Asia, and America, and ASF in China. These analyses brought insights into risks and timely mitigation implementation, including predicting the appearance of ASF in a specific Chinese province months before its first detection in Asia. In her previous position, Sylvia worked as a senior veterinarian for APHIS, Veterinary Services, Regionalization and Evaluation Services, analyzing animal disease status of exporting region or countries to determine the risk of introducing livestock diseases into the United States. She has also led many of the FMD, bovine spongiform encephalopathy, poultry and swine diseases evaluations conducted by APHIS. Sylvia has worked extensively on BSE and other prion diseases, and has played a key role in the BSE risk assessment conducted by Harvard University, as well as several other assessments on livestock products and commodities conducted by the United States government. Dr. Kreindl has been a member of the Global Framework of Transboundary Animal Diseases Working Group on FMD, the World Health Organization Working Group on Global Early Warning System, and the FAO Ad Hoc Group on Antimicrobial Resistance. She has also been a member of the Food and Drug Administration Transmissible Spongiform Encephalopathy Advisory Committee between 2007 and 2012, and a member of the Canadian Prionet and Alberta Prion Institute Ad Hoc Group on Chronic Wasting Disease. She received her doctorate in veterinary medicine from the University of Buenos Aires, Argentina, and her Master of Public Health in Epidemiology from the University of Massachusetts. Considering her vast experience, let me then give Sylvia the floor so that she can start her presentation. Thank you so much for inviting me to participate and to present our experience and to tell you the way in which from the USDA and the APHIS from the US have tried to assess the risk and to assess communication and risk communication during this crisis. There we go. This presentation will mostly deal with the activities that we have been carrying out to prevent African swine fever to escape to the United States. Of course, the United States is particularly keen on preventing the cases of African swine fever in their territory, but it's also interesting to, and we're interested in trying to keep ASF2 going into any country in the Americas continent. We want to keep it from escaping from the Dominican Republic. And why is the Dominican Republic so important to us? Well, about 2.8 million people with Dominican origins are living in the US, and they are constantly moving back and forth from Dominican Republic to the US and vice versa. From Dominican Republic, we have about 500,000 people who live from Dominican Republic to the US. As you know, the Dominican Republic is a very important tourist spot, and there are about 8 million tourists, or over 8 million tourists, who visit the Dominican Republic a year. As for the Dominican people who live or travel to the US, we know that they mostly visit or go to New York, New Jersey, and Florida. We need to highlight the fact that Swine product consumption in the Dominican Republic is something that is quite typical and a cultural aspect as well, and visits to the US are highly related to the transport of typical Dominican products or food. So this is pretty much the profile of the situation that we have with regards to people traveling to the US. But of course, the entry of African swine fever to the US is something that terrifies us because swine production in the US contributes with about $57 billion in their GDP, and it employs over 500,000 people. Should the African swine fever get into the United States, it would also affect not just the economic security, but also the food security. Also, it is estimated that the entry of African swine fever to the US would be linked to economic losses of about $15 billion in a 2-year scenario. So, as you know, there are many people who come and go from the Dominican Republic to the US and vice versa, and we acknowledge the fact that communication in this regard must be targeted to the type of people who travel from the Dominican Republic to the US. The goal of this campaign is to educate the public and to prevent travelers from taking pork or swine products to the US. And as Leticia said before, we need to intervene to have an impact on the people's behavior. It was defined and agreed that the communication campaign should be simple, direct, and massive. So, who are we trying to address this campaign to? Well, this, for example, would be one of the persons that would perhaps carry some swine products, a lady called Altagracia. She's 55 years old. She lives in Santo Domingo, and she travels from the Dominican Republic to the US to visit some relatives, her aunt, and someone like this lady, this 55-year-old lady, is someone who listens to the radio a lot. She's at home. She uses Instagram, Facebook, and talks to friends via WhatsApp. Another one of the campaign profiles is a profile of this man. This man is about 59 years old. He's visiting his relatives, his Dominican Republic relatives. He lives in the US, and he will go back to the US carrying certain products. People generally eat chicharrón, that is fried pork, and they carry it frozen, and this is something that he could be carrying back to the US. This kind of person communicates online via Facebook and WhatsApp. They listen to interviews, and they trust their friends in terms of recommendations. So in summary, the profile of people that we're targeting is between 18 and 60 years old with a medium to low socioeconomic level, and these are travelers from Dominican Republic who generally live in Santo Domingo. As you know, this is a brochure that we have prepared on the products that you cannot travel with. And in recent assessments, we have seen that it is mostly women, the ones who transport these kind of products. So that's why we included a woman in the brochure. We wanted to have Dominican women associating with this drawing. The strategy behind the messages is a very precise message, attracting different age groups, highlighting the fact that they cannot travel with certain swine products. Also, they want to use Dominican humor or resort to Dominican humor using phrases or images that can be easily identified and can be memorized so that they remember these kind of messages and learn via these messages.
The concept that we use was do not take that with you because pigs don't fly or shouldn't fly. Don't go with that. Pigs don't fly. You will see certain charts and graphs and illustrations that show why you cannot travel with pork or pork derived products and the consequences of carrying these products with you. These are some of the billboards that we used, different sizes in different parts of the city. We had signs near the airports to remind people, you know, not only to remind them, but also for them to get them thinking, you know, about the message. We have like a video that we shared. The video describes how you shouldn't take pork with you, and if you're at the airport, that you shouldn't take any pork products with you. They describe all the byproducts, including ham, salami, and others. And more information on this website. This is sponsored by the Embassy of the United States. The message was used for TV ads, and a similar message was used in the radio. Mainly, what was done is to use music and to have um, to engage people with music and to convey the general concept. This campaign was organized along with the brochures included in the campaign. They were used at the US Embassy. Every person that goes there to look for their visa, they hand in their passport, and when they get their passport back, they get the brochure inside their passport. We hope that they read, of course, the brochure, and we just share the exact same information. The ads are placed at a certain time of day so that the target audience that we are targeting can hear it appropriately. This campaign also is managed and synchronized with other agreements with OIRSA and APHIS using dogs that are used in different points of the Dominican Republic. And these dogs, dog and human, of course, pairs or duos are focused on finding and identifying pork products such as pork rind and other byproducts like salami and ham. Those who deal with pork and pigs in their farms know that these products may be seized at the airport pursuant to a regulation that is in force for now 3 or 4 months. The products are seized and they determine whether the profile of the travelers will change if they are part of the high risk group who are most likely to carry these products with them at these moments. In the latest data that we have, we know that the products that are seized in the airports, out of them, 47% are cold cuts that derive from pork. This is the profile that we identified, the sex, the age of the person, why they're going to the United States, if they're going on tourism, visiting family, etc. So this allows us to be much more specific also in terms of how we find the products and how we approach the matter. The type of bag in which these products are carried, if these are boxes, suitcases, etc. The destination and the airline. There are certain airlines that allow more luggage than others. For example, the airlines that go to the areas where we have more population of the Dominican Republic, like I said, New York, New Jersey, and Miami, those are flights that are really targeted by our initiatives. For the campaigns organized for 2023, we are adding other variations, such as these infographics that you see on the back of that bus. You can see the message here in Santo Domingo. You spend a lot of time on the traffic, traffic jams, and you have no option but to read the ad that is in front of you on the bus. And so that is a good opportunity. We are also targeting a higher number of ads and more advertising and use influencers also who can help us and focus on the populations that constitute a risk for us. The dogs that are used in the Dominican Republic through the APHIS OIRSA agreement, and also certain reports on seizures that are done in the United States on flights originating in the Dominican Republic. The campaign is always assessed, and we see how the campaign has been productive, and it has resulted in a reduction of the transportation of these products. However, we need to continue moving forward and continue to verify and check messages and the association between messages and what we find, and try to intensify this as well as to target it better so that it is more effective. These are other cars and vans that we are using and that we will be using to transport the dogs, and we use them for advertising as well while they're transporting the dogs. So you can see here the signs. Do not carry that, pigs don't fly. And here, of course, we see how this is definitely a teamwork, not just with international associations, but also with the APHIS office in the Dominican Republic. This is definitely joint work. So I would like to acknowledge the work of everyone who works with me in this topic. and the efforts that each one of us is making just to outline it in terms of our goal to control ASF in the region. So thank you very, very much. Thank you very much, Sylvia. I think that all of the initiatives that you've described are very, very interesting in terms of communication in the Dominican Republic. And I really like the logo of Pigs Don't Fly, so congratulations for that. So before we move on to the questions, which are the last part of our webinar, we will give the floor to Alonso. Alonso will be discussing initiatives for crisis communication that have been developed by OIRSA for the Dominican Republic. So Alonso, Stefani is a veterinary doctor and is an officer of animal health for OIRSA. He's responsible for the regional program of pork health at OIRSA. So Alonso, you have the floor and you can share your screen with your presentation whenever you're ready. Good evening, good afternoon, good morning, depending on where you're connecting from. Thank you very much to all of the entities that have made these series of webinars possible. I would like to also thank you for this joint effort, of course, always with the support of GSTAT. Today, I would like to discuss the initiatives developed by OIRSA and everything that has been done at the level of communication ever since ASF was detected in the Dominican Republic. And before I start talking about this, I would like to take a few steps back. Let's go back to 2018. In 2018, OIRSA had already started developing and disseminating these general recommendations for prevention in terms of preventing the disease from entering the country. And this, of course, was issued to all the countries in the Americas. Already in 2019, we had already started holding a series of workshops and webinars and seminars at the time, specifically one virtual regional seminar on ASF, which was in Guatemala, but featured different experts, farmers from the public and the private sector, and from all the countries of the Americas. At the time, this series of seminars continued taking place in different countries of the region. In 2019 as well, we worked in the development of not only recommendations overall, but also working on early warnings on the different risks and dangers, because the import of these animals and byproducts from countries which at that time were affected by ASF. Since then, OIRSA was concerned about this and had an initiative to issue these alerts so that countries would start preparing in the face of a crisis. These recommendations had to do with preventing the entering of the virus, and more technical recommendations started to be issued, including a series of workshops on dissemination that were taking place a few months back. So this allowed the organization to start developing more specific recommendations. Here you can see part of the material that was used for dissemination and that was developed back then, where there were videos created both in Spanish and in English, flyers that were translated also into English and into Spanish, infographics, flyers, etc., that were distributed among the ministries and secretariats of agriculture so that they could in turn facilitate them to other veterinary services and start actually disseminating the information so that in every corner of OIRSA countries, the information could reach and they could have access to it. And eventually they could prepare accordingly. We started developing workshops, but we also had a simulation, a drill, yes, at a regional level for African swine fever, also hosted in Guatemala. So what we did was train approximately 45 members of both public services and private services of the member countries. This included the participation of national directors for animal health, directors general, and those who were responsible for the pork sector, the swine sector at the time. It also included relevant entities at the time. They all played a key role in divulging the information on ASF, which had already been developed months before. At the end of 2019, up to mid 2020, OIRSA was working on the creation and dissemination of a regional risk analysis in order to know the likelihood of the virus entering and being disseminated in some of the countries. Already in 2020, we concluded this risk analysis. And back then, the results were that the Dominican Republic and Panama were the countries with the highest likelihood of uh, having the virus enter their territory. As you already know, 2021 was the official declaration of the detection of ASF in the Dominican Republic. And this is why OIRSA, uh, since the end of 2021 and beginning of 2022 up to date, has developed programs involving risk analysis. And the idea is by the end of 2023, we will have an updated version of this risk analysis. And now in mid 2021, when the virus was declared in the Dominican Republic, the government issued regional warning because of an outbreak of ASF in the Dominican Republic. There was technical assistance provided in the field and both at administrative level. The Ministry of Agriculture and Livestock of this country, 48 hours after the outbreak was officially declared. Immediately after, uh, a committee to eradicate ASF was created, and which was the result of the first technical mission that took place at an interagency level. From the WOAH, ICA, and OIRSA, which were part of the initiative and had a high level of participation, which of course was paramount for that initial work. After that, we started working with the emergency committee of the country. And I also had a support for the first part in terms of the management of the emergency. After this, we started working on updating, drafting, and disseminating the dissemination material that we had for some time, but it was specifically tailored to the message that was needed by Dominicans as citizens. We all know very well that Dominicans are very friendly. They like to speak to one another in an informal way, and they like to get together. Yes. So based on this, we started developing the infographics, and all of the material was really sort of translated into the language spoken by Dominicans. Yes, because if this is the case, citizens prefer to receive their messages from their peers. Yes, farmers from another farmer, etc. So we sort of repurposed all of the messages so that the person who was receiving it felt like it was one of their peers addressing them.
This is what we used for radio spots so that we would be working with all of these general aspects of African swine fever. At the time, we created 3 videos that were adapted to everything, as I said before, so that Dominicans would feel that they are being addressed by a colleague. So we started to provide support with online and face-to-face training sessions by the Ministry of Agriculture and the National Directorate for Livestock. They would be organizing these workshops for official veterinarians in the Dominican Republic and also for private veterinarians. There were also regional informative sessions on the health situation in the Dominican Republic at the time, and we carried out updates on the different components in terms of the response to the health crisis. Following the training sessions, by mid-2022, we carried out a practical and theoretical workshop where we trained a group of public veterinarians who would then become the disseminators of information. They would be circulating information, and they were deeply trained on disinfecting procedures, cleaning procedures, and biosafe disposal of animal carcasses. During that workshop, we filmed some educational videos for the media. These videos were broadcast among the different social networks of OIRSA, of the National Directorate for Livestock on YouTube as well, and via WhatsApp. We circulated these videos to most of the members of the official veterinary service. These videos are quite self-explanatory, and you can sit and watch them, and it's as if you were being taught by a professional directly, because they are quite in-depth in terms of the message communication. By the end of 2022, as Dr. Mati Perez mentioned before, we carried out a swine inventory or pork inventory because the country needed to know the current status of the population, the swine population that we had at the time. However, we we entered into a collaboration with the Culture Ministry, the FAO, and OIRSA, and we created a message. We printed some flyers and we carried out soundtracks, campaigns, so that the message would be circulated to people in the most rural areas of the country. And we realized that this was a huge success. Not only the use of soundtracks in rural areas where they were able to listen to other producers or other farmers talking to them, but also the face-to-face contact that was carried out by those who were doing the stock or the swine inventory. They were delivering as well flyers, brochures, and they were raising awareness on this issue, and that had a key role so that the remote area farmers, the most rural farm area farmers, would be informed. They are raising pork there, and in these areas, pigs are, and pork is a key part of their diet. So most of the rural population have at least one pork, and so it is fundamental to carry the message to that kind of remote locations, and it had a huge impact. That is why we decided to work with dogs, and this we started implementing it in the Dominican Republic by mid-2022 to raise awareness among travelers, tourists, incoming and outgoing travelers. These people have been trained and have these kind of messages that you are seeing on the screen, and the pigs don't fly message that the doctor explained to us in the previous presentation. So they were handing out flyers and talking to the travelers. This strategy has been quite useful because travelers leaving the country now know that they are not supposed to travel and transport pork or swine products and byproducts. And when they come back to the Dominican Republic, they tell their families, no, we're not supposed to carry these kind of products. And so therefore, this information gets disseminated and circulated. So a great lesson learned is this face-to-face contact. We know that that is now essential. And when it comes to radio spots, we had to create these messages in which a farmer talks to another farmer or a producer talks to a colleague. And this was the way in which the Dominican farmers welcomed the message and responded to it in a more positive way when it comes to dealing with African swine fever virus in the Dominican Republic. We must say that most of the messages that we have prepared have been done jointly with the National Directorate for Livestock, particularly with Dr. Mati Perez, who spoke second today. And we would deeply like to thank her because she was part of the core team in the preparation of these messages that could be circulated and welcomed by most of the rural farmers in remote areas. This is all for me, and thank you so much. If there are any other questions, I'm available for you. Thank you so much, Alonso. It is a huge effort that all international entities, OIRSA, FAO, ICA, and the USDA have joined so that they could help with the emergency situation in the Dominican Republic and in Haiti to prevent as well the spread of this disease in other countries. Thank you so much to our marvelous speakers today. All of your experiences that you have shared paint a clear picture to our audience with regards to the measures that need to be taken to prepare for a crisis communication. As Leti said, we need to prepare for crisis communication in times of peace, and that is the best way to do so. Let's move on now to the Q&A part of this session. We have many questions jotted down. We will be looking at them, and please, if you have further questions, you can write them down in the chat. And before we begin, we still see new people introducing themselves. Andrés Mamonte from Cancelero, Uruguay, leading Frente de Acción por la Salud in Bolivia, and colleagues from Peru as well. As you know, we have different sectors participating today with different roles in prevention and response to the emergency of African swine fever and other transboundary diseases. Letty will begin with you. We have been reading the questions throughout the presentations. And one of the questions is, should institutional communication teams be related or dealing with the technical work in terms of communication? Yes, I'd say so. Yes. I was reading the questions, but I didn't find that one. Anyways, I think that one of the main problems that communicators face in terms of crisis is some sort of learning curve when it comes to technical teams on the need to have the communicators side by side so that they can be able to translate what they want to say or how they want to say it to the different audiences. So if the question is, should communicators be working side by side with technical people? Yes, of course. In my experience in public health, that was a very steep learning curve, but it bore fruit. It was fruitful. If I can tell you in one of my public health experiences, well, I started in Pejo after the cholera outbreak. And the relationship between the communication team and the response team was quite strained. And that didn't really help for things to flow. And as time went by, there were many trainings targeted for technical people and technical staff on how to address any potential crisis from a communication perspective. Really helped them consider that in their own perspectives, and so that when the next crisis hit, they would come to us and sit with us at the planning table when it came to organizing the response. And for the chikungunya outbreak, we were a core part with the team, but it took years. Thank you, Letty. Silvia, do you want to go ahead? Yes. I agree with the fact that communicators should be in contact with those carrying out risk studies or risk assessments, but more importantly, they need to be in contact with those handling the risk, making the decisions on how risk is going to be addressed, rather than with technical staff who are working on the risk assessment. Because in many cases, risk management may have some sort of political bias. So everyone needs to be sitting around the same table to see what wants to be communicated. I don't know if Leticia, you agree with that. Right. I don't know how this is done in animal health terms. On public health, we create an incident management team and everyone goes there. The technical staff and everyone is in there. It's a table around which everyone is sat. And the interaction changes. First, you need to deal with the risk manager, and then you need to work with the incident commander, and then, if you're lucky enough, with the directors as well. But I do think that a good summary is that the communication is cross-sectional, particularly during an emergency. They need to know everything because something might go wrong due to political decisions or due to the interpretation of a risk assessment that a technical person wrote something for a certain audience, and then you might have a problem there. So I do agree, this is cross-sectional and it is essential to be sat with the political deciding parties. Sometimes they forget about communication and then you get a bomb dropped on your lap and then you need to explain decisions and to do things that you were not supposed to do. Thank you, Leti. Thank you, Sylvia. It is important that communication should be cross-sectional and the message should be communicated and supported by technical staff and decision makers, because they will be the one endorsing the communication. We have another question, Leti, and it says, which would be your recommendations to approach communities taking into consideration their culture, their sense of belonging to an ethnic group or an age group or even a religious group? Well, there will be a different approach for every different group. I really liked what Sylvia showed on their campaign because they were clearly defining target profiles when they prepared the messages and their campaign. To approach a community, you need to consider that. Am I the man in a suit who needs to work with the community and approach the community? Am I the right person? Perhaps I should identify the leaders or the sort of quote-unquote champions of the community who have a better relationship and who are listened to by the community. Perhaps those are the people who should be building the bridges so that the community can accept our message. I think that the most important thing is to try to forge those bonds with those communities before crisis hit. I think that we learned that the hard way through different crises of public health. But that's the point, building the bridges beforehand, trying to identify the things that are worrying for that community, perhaps holding meetings with their leaders every once in a while, keep them in our radars, talking to them, approaching them, see what is worrisome for them, see what you can do with regards to their value system, where there might be some resistance or perhaps a challenge instead of a resistance. And I think that the most important thing is try to foresee where you will have some problematic points. You will never be able to foresee properly, but at least you will be better prepared for when a crisis comes. You will have been already planning around the community. You will know the people of the community. You will have already talked to them. You have a bond with them. And I think that's what's important. Something else I would add is that Whether you're talking about religious communities or or cultural communities, well, you need to address them with a high level of respect, respecting their beliefs. It's very difficult to earn people's trust, and it's very easy to lose people's trust. If you try to go in knocking down doors, or if the community feels like you are disregarding or diminishing the way they see the world, it will be it will not be beneficial, and then you then will need to try to see how you get the community to do what you need them to do. I'm sorry, I keep giving you examples of public health. This might be a bit extreme, but when I was in Liberia working on the Ebola outbreak, one of the main problems that we had was that we had 16 different tribal communities, and none of them really understood. We were asking for them to do very complicated things, and the thing is, nobody really believed that there was an Ebola outbreak. So the only way to get to those communities was to talk to the tribal chiefs. They had their own decision making processes and meeting processes, and it was not until we actually met with some of them when we showed that there were people who were sick and actually survived Ebola. And that was what it took for them to understand that they needed to take precautions with the disease. So, what I mean is, we needed to get into their world and to get the message across to their world so that they would change the response. That would be then my advice. Do the pre planning, identify the leaders, identify their belief system, identify the pressure points, and then you can start working on effective messages.
Gracias, Leti. Esto es muy pertinente para todas
Thank you very
nuestras.
much, Leti. This is really relevant for our communities, not just in indigenous communities, but also rural areas, small scale farmers, etc. So I think these are all aspects to consider. Leti, we have another question, which is, although there were plans and programs to prepare and address pandemics at a global level, ever since the avian influenza at the beginning of the 2000s, what other recommendations would you make to face these new pandemics based on the lessons learned from COVID-19? Well, I think that this is an ongoing process. I think that the most important thing that people have learned is that pandemics come and go, but pandemics can change your life completely. When there was in 2009 the H1N1 outbreak that started in Mexico, and so we thought it would only happen in Mexico, a little bit here, a little bit in Argentina, here and there, but this pandemic, COVID-19, really changed our life completely in so many different aspects. So I don't know what the next pandemic will be and what challenges it will bring about, but the truth is that for 10 years, we spoke about the possibility of a pandemic, but the tensions sort of de-escalated at a political and institutional level. And although there were plans, like you say, there were many plans, there was a lot of delay in actually realizing that this was something that could really affect all the way to the root of the problem in each country. So I think that the first thing to do is to continue planning, always updating those plans, always thinking of the worst case scenario. At the beginning of the response, when we were implementing public health measures such as staying at home, these extreme measures like really lockdown and closing of schools, all of these things that we hadn't seen but had happened in other moments of history. So I think that if there is one major lesson is that it can happen again in the future. And we do not know why, we do not know how, or in what way, but how to approach rumors depending on how on the history and on the moment. facing the challenges of public health, and as you know, probably for animal health, is to really determine how it will appear in the next public health crisis, because there will be another crisis for sure. Big, small, it will affect us more or less. We do not know this specifically, but we do know that the lesson learned from the COVID-19 pandemic is that it can come unexpectedly or from a different side. We were thinking of influenza and it came from a coronavirus. It was different from what we were expecting, but it happened. People were always thinking that the public health measures to stay home and lockdown, we thought it would be 3 weeks and then return to our normal lives. And it was a lot deeper, a lot longer, and we're seeing consequences even today. And there will be other consequences that we don't even know about. So the worst case scenario can happen. That's another lesson learned. And I think that when planning and when thinking about these scenarios, we should never sort of take it for granted that we've covered all bases. I think preparation for the worst case scenario and preparing for multiple scenarios, I think that's essential. And everything that you learn will be applied in the next crisis for sure. You continue to recycle and learn and improve the response to the different crises.
De
Thank you,
algo
Letty.
estamos seguros, que la preparación
One
para
thing
la
is certain,
preparación
and it's that the
de las
preparation for
emergencias y de
preparation
la prevención de
for
las emergencias
emergencies is
no
key,
termina,
and
es
it never
constante.
ends.
Así
It's a
que a seguir
constant and
preparándonos
ongoing
y mejorando
process.
y aprendiendo de las
So we should
experiencias
continue to prepare and
pasadas.
improve.
Hay otra cosa
There's
que he
one more
visto a través
thing,
de todas las emergencias y
and
creo que también
I
es
think this has
un
been the case in
aprendizaje
all
importante.
emergencies, and it's an
Siempre va a haber
important
negación
lesson
al
to
principio.
learn.
Siempre
There
va a
will
haber
always be
resistencia a que
denial
esto
at
está
first. There
cambiando y
will
que es algo
always
distinto
be
que
a
nos afecta en la
resistance to
vida. Pasa
believe that
con
this is changing our lives. It
todos los
happens
nuevos
with every
brotes de
single
algún
new
tipo de
outbreak
enfermedades,
of
pasa
a
mucho
new
más a nivel
disease,
de pandemia.
and
La
much
negación es
more
la
so
primera
when there's a
respuesta
pandemic. Denial
natural
is the
que uno
first
tiene. ¿Te va
natural
a cambiar la vida?
response.
No, no,
It will
no,
change
vamos
your
a
life. No,
decir
no,
si te
no.
va a
My
cambiar.
life will
Quizás
not
un poco más
change.
de
My life will
preparación en
remain the
eso,
same.
de
So maybe
aceptar
more
que va a haber una
preparation in
negación al
terms of
principio y
acceptance.
trabajar con el
Acceptance that there
mismo que
will
va a
be
negar
denial
hasta un
at
punto
first,
y
and that
trabajar en eso creo que
one,
sería
it will be,
importante para
you know,
próximas
each
pandemias
person
o
who will
brotes
be
o crisis.
denying this at
Gracias,
first.
Leti. Excelente. Otra
Thank you,
pregunta por
Letty.
acá. Yo creo
Another
que esta,
question.
como
And I
es de
think
manejo
this
político,
question is more
también lo puede,
political,
lo dejo
so
abierto para
maybe
que
it can
posiblemente
be
Silvia o
answered by
Alonso o la
Sylvia or
doctora Mati.
Alonso or Dr.
Entonces,
Mati.
nos preguntan por
The
acá, ¿cómo
question
gestionar
is,
las fisuras
how
o grietas
do we
en la
manage
comunicación de crisis
the
cuando los
cracks
políticos
in
generan
the management
información
of
no
crisis communication
compatible
when
con el
politicians
plan?
are disseminating
Entonces,
messages that are not aligned
ahí,
with the plan?
te dejo
Well,
la
when there are
palabra, Leti,
fissures or
por favor
cracks there
complementen
in
los
in
demás.
the messages.
Depende de quiénes sean los políticos, si son políticos de
It really
oposición o
depends. If the
al
politicians
gobierno
are
de
from the
turno, es
opposing
muy probable
party,
que uno tenga que prever
uh,
en su plan que va a haber una
probably you will have to
resistencia
plan that there will be
en el fondo
resistance
político que va a
in
hacer
the
ruido
political
en el tipo de
arena, and that
comunicación.
will affect the
Y creo que en
communication.
cualquier plan de crisis hay que
And I
prever
think in
que van a haber
any
distintos desafíos
case,
y uno de
there
ellos va a
will
ser
be different
que va a
challenges,
haber distintos grupos, muy
one of which will
probablemente grupos
be
que
the
estén
fact that there
a
will
nivel
be
político, que
many
tengan una serie
groups,
de intereses
uh,
determinados, van a
political groups
ir
that will have different
en
interests
contra de esa
and
información
that
y creo que
will
en contra
go
de lo que
against
uno quiere
that
hacer en ese plan
the
para
message and the
apaciguar la
initiatives that one
situación o
wants
no
to
pasar la
implement
crisis.
or the plans to address the
Ahí
situation.
creo que hay distintos caminos, ya
I
dirán
think that
los colegas cómo lo han
uh,
afrontado,
colleagues will probably say
pero
how they dealt
creo
with it, but there are one of
que
many
muchas
possible
veces
approaches.
si uno responde directamente, quizás no
Sometimes if you
logre el
answer
efecto que
directly,
necesita.
you will
Ahí es
not
cuando
achieve the
vienen
desired
a
effect,
colación
and
quizás
that's when
campeones o
there
campeones que
are
puedan hablar por nosotros y
maybe
que tengan una
champions that can
credibilidad
speak
bien
on our
alta y que
behalf
puedan
with a
como
high level of
elevar
credibility and that
el
can
debate y sacarlo del
actually
ámbito político, que si no
elevate
se convierte en
the
oficialismo
discussion,
versus
because if not, it
unos u
becomes a
otros, eso
political,
puede ser
thing,
una opción.
one party
Si
versus the
estamos
other.
hablando de políticos que están
And if we're
dentro de
talking
la
about
casa y que
politicians
también
that
tienen un
are
interés
in the
quizás
House
en
and
complicarle la existencia a algún ministro o
that
alguna otra
want
autoridad,
to
pero están
maybe
todos
make
dentro de
life
la misma
complicated to an
institución,
authority or a
creo
minister
que
or
ahí
something, but they're all part of the
es
same
complicado, pero es
institution.
como gestionar a nivel de medios la contradicción que siempre
And
va a ser
the
noticia y
contradiction,
ahí hay que
which
ver
will
cómo son los
be
procesos políticos de
news, and
cada
we have to see
institución
what the political
o,
processes are for each
o gobierno para manejar
institution
ese tipo
and
de
the
diferencias
government
internas que
to
salen a
manage
la luz.
the
No sé si mis
differences
colegas
that
tienen
come to
algo más
light.
que
I
agregar
don't know
o
if
si
my
tienen solo
colleagues want to
preguntas,
add anything
la
else.
considera respondida.
I don't know if they believe
No sé
the
si hay
question
algo que
has been
agregar.
answered.
Si
Is there
no,
anything to add?
continuamos con la siguiente,
If not, we will move on to
que,
the next question. This
que es interesante.
question is very
En el
interesting.
caso de enfermedades
In the
transfronterizas,
case of
se recomienda generar
transboundary
planes
disease,
de
the
comunicación de
recommendation is to
crisis
generate plans for crisis
regionales o
communication,
multipaís.
regional or multi-country.
En
Is
el
that
caso de salud pública hay
advisable
experiencias de comunicación, o sea, de planes de comunicación de riesgo para amenazas transfronterizas. Un ejemplo claro
for
era, fue en su
transboundary
momento
threats? For
fiebre amarilla,
example, at
que
the
había muchos
time we
casos del
had
lado
yellow
brasileño
fever.
y se estaba
They
trabajando con
had many
Paraguay,
cases in
creo que
Brazil, and they
también
were working with
Argentina,
Paraguay
pero
and
lo que
also
sucede es que ya
Argentina.
había
What
mecanismos
happens
de
is that there were
cooperación
already
a nivel
cooperation
transfronterizo
mechanisms in
en
place,
otras áreas. La comunicación de riesgo
transboundary
fue como algo
initiatives. So
que se
risk
agregó
cooperation was
en ese
sort of
caso
added to the
y
mix
sirvió hasta
in
un
that
punto, pero
case.
era
And it was
más un
useful up
mecanismo
to a certain
de
point, but it was more
coordinación
of a
y de
coordination
ver cómo se
mechanism
manejaba y de
and
alinear ciertas
one
respuestas. Después
to
cada país también
set
tenía
to
su propia
align the
respuesta porque
proposals.
se va
But
a
then
mover de
each
la
country had
frontera,
its
¿no?
own
Pero
proposal.
eso en el caso de salud pública. No sé
That
cómo
in the
es
case of public
a
health.
nivel de salud
I don't know what
animal.
it's like at the level of animal
Pero
health,
sí.
but I think so.
Sí, yo quiero agregar,
Yes, I would like
basado en mi
to
experiencia,
add that
los
based on my
planes
experience, the
multipaíses, ellos seguidos de
multi-country
comunicaciones de
plans
riesgo, ¿no?
followed by risk communications,
Digamos, a nivel transfronterizo, como entre
and if
países
we
o
consider what
situaciones o
happens or
enfermedades
maybe
emergentes
situations
como
in countries with
aftosa
emerging
o
diseases like foot and
resinación
mouth
o
disease
digamos la
or
labor
ASF, of course the work
las instituciones
of
internacionales como
institutions
OIRSA
such
trabajando en
as
su región,
OIRSA working in their
tratando
region,
de compartir la misma información y
trying to
yo he visto
share the
que
information.
las mismas
I've
comunicaciones
seen
quizá
how
también con
in
pocas
the
variaciones se
communications
usan
with different
en países
variations,
similares, ¿no?
this
Como
is used
el
in
plan
similar
seguido de
countries,
la
and how the
comunicación, el
plan
plan
followed by communication
para afrontar las enfermedades
in order to address
comunicadas.
the
Eso
diseases and
ahora
communication.
la República Dominicana,
In the
una de las
Dominican Republic,
iniciativas es
one of the
trabajar en
initiatives
una
is to
región
work
donde tengamos
in
intensificación
regions
de
where there is an
respuesta
intensification
hacia
of
la
the
pandemia,
response uh,
donde
in the
se
face
encarece
of
la
ASF, where we
comunicación
have
más
to deal
eficaz
with these
en esa
types
región
of communication,
en especial, ¿no? Que va a ser un poco
and
diferente
it will be slightly
del
different
resto del país.
from the rest of the country.
Un país regionalizado a través de esfuerzos con
And this is
comunicaciones
through
similares,
efforts
pero
made in
enfocadas
communication that were
a
similar, but that are focusing
distintos
on
objetivos.
different objectives.
Perfecto. Muchísimas gracias a ambas. Acá hay un
Thank
comentario
you
sobre la presentación de
all.
Leti. Dice, comunicar
Here's
es
a
ofrecer
comment.
elementos claros
Communicating is
de los
providing
riesgos
clear
y casos
elements
de
of the risk
enfermedades
levels in the
emergentes u
case of
otras
emerging diseases or others
comunicar
that
información
require
epidemiológica sólida. Eso es
solid
anónimo.
epidemiological information. This is anonymous,
Escribe la
so
persona.
they didn't write their name.
Y acá hay una última pregunta para ti,
And
Leti.
one last question
Es
for
así,
Leti.
¿cómo se puede realizar un diagnóstico efectivo de la comunidad
How can we
debido a
do
quienes van
an
dirigidas las
effective
campañas?
communication for those that are the recipients of the
Sí,
campaigns?
bueno, eso en muchos casos depende de cuántos
In many
recursos se
cases,
tengan para poder hacer esos estudios, ¿no?
These are studies that are conducted, and of course, when there's a lot of budget, we can do focus groups and monitoring, etc. When we don't, which is in most of the cases,
una de las lo primero creo es
the first
conocer
thing,
cuál es el
in my
resultado
opinion,
esperado de
is
la
to
comunicación,
establish the
no el
expected
objetivo
result of the
que yo quiero
communication,
lograr,
not
sino
the
el resultado.
objective, which is what I want to
La
achieve, but
audiencia
rather
que
the
elijo
result.
haciendo
Yes, what
exactamente
is
lo
my
que yo
target
quiero, ¿no? Y
audience?
eso es una
And whether
evaluación.
they're doing
Y
exactly
si
what I
realmente
need
están
them to
haciendo lo
do.
que yo quiero, sí
Are
o no.
people doing what I want them to do? Yes or no?
También
That's one point of
decirme
reference. Another important thing
cuánto
is
tiempo espero yo
to
este
determine
resultado, porque
how
si yo quiero
long
que
I
venga
need in
en
order
un
to achieve
año,
this
bueno,
result. If I'm
no hago la
expecting this
evaluación, sino
result after
espero mi
1 year, I
resultado.
will assess after 1 year. If
Entonces,
I expect this to
tengo que
happen
ver cómo hago para que mi
immediately,
mensaje sea mucho
I
más
need
efectivo y
to see
relevante.
how
Y
my
ahí
message
también
can
lo
be
puedes
much more effective.
medir, ¿no? Ahora, ¿cómo medirlo? Eso es una gran
So how to measure
consideración.
it?
Primero, monitorear. Creo que muchas veces las
First,
redes
I think we
sociales,
need to monitor things. Many
comunicación,
times,
digamos que
social
nuestra
media
audiencia
and
la
communications
sigue
are
digamos,
followed
por
by a
nuestras
part of the audience.
expectativas.
So that, in a
En
way,
esta sociedad, por
provides
ejemplo,
an
enseguida
indication of what is
llamábamos
happening.
cosas
In the case of the
superficiales
Zika
que nos
virus,
obligaban a
there were
cambiar
immediately things on
nuestro
social media
pensamiento.
that forced
Entonces,
us to adjust our
si se
messages,
notaba que
especially in
algo
Brazil,
estaba
because it was
disonando
evident that
con el
something was
mensaje
not
de vuelta o
really
la
being
reacción de
conveyed in the
vuelta
right
no era
way.
la
It
que
was being
esperábamos.
altered,
Entonces,
or the
¿cómo va a
reactions were
funcionar
not as
el
expected.
tema de
Um,
redes sociales? Quizás
on social
haciendo
media,
escenarios,
maybe when there are
entrevistas
questionnaires,
con
or
representantes
interviews with
afectados,
representatives of the
entrevistas viendo
community to see what
cada
exactly they are
cada
understanding
cada 2 semanas y todo eso,
with a certain
las semanas,
frequency, every
meses,
2 weeks or every
la
week,
audiencia
etc.,
de,
depending on
como
the
decía, casos
urgency and
particulares y
depending
específicos
on when
de
you need to
comportamiento.
achieve this
Y en
change in
función de eso se
behavior.
puede recoger
Based on this, we
material de
can
calidad para
try
ver
to
dónde
gather high quality
exactamente es
material to
donde el
see
usuario necesita tener más
where
cuidado, si
these
está
messages
eligiendo
are being
esa
conveyed, to
reacción
what
anterior de la que
communities,
hablábamos para
and
poder
the
hacer esa
prior
evaluación. Y eso es
elements, so
quizás
that
no
we
sea
can
tan
determine that.
complicado y se puede hacer con
And
menos
maybe it's not as
recursos,
complicated and it
bueno,
can
se
be
evalúa
done with
qué
fewer
están diciendo los
resources.
líderes, qué es lo que están diciendo en reuniones
So we
con
need to
vecinos
determine
y buscar la manera de escuchar a todos,
and
porque
find the way to
yo
listen
creo
to
eso
the
es lo
communities and
fundamental.
adjust the messages there. I'm
Te
sure
cuento una
Sylvia has more
cosita.
experience to share.
Sí, sí, gracias. Bueno, no, en realidad yo lo que quería comentar es que nosotros medimos el mensaje, tratamos de
I
medir
just
el
want to say
mensaje
that we try
y
to
evaluar
measure
las
our messages
comunicaciones,
and evaluate
tratar
whatever
de
seizure
conocer
takes
varios factores,
place.
así
And
que
we try to
estamos
control
mirando
several
exactamente lo
factors,
mismo.
but we are always trying to
Y
measure the
una
same thing.
de
Yes?
las,
So,
de las slides que mostré
in
es
the
exactamente
slides that I've
eso,
shown,
cómo fueron
it
cambiando las
indicates
constituciones a
specifically
partir del
how the
momento
seizures
en que
changed
empezó la campaña, que
after
es
the
realmente
campaign
lo que más nos
started.
interesa a nosotros. También nos
So
interesa ver
we are
si las
also very
personas
interested
que nos escuchan
in
cuál
knowing if
es
the
el
profile
perfil que
of the
debemos
people that we are
enfocar
targeting
y
is actually
cómo
the profile of people that we
nuestro,
should be
nuestras campañas
targeting.
son mucho
Furthermore,
más
our
efectivas,
campaigns
¿no?
need to be much
Para
more
que sea mucho
effective
más
in
efectivo
order
también el
to make
trabajo que se
sure
hace
that the
en los
work that
aeropuertos.
we do
Por
in
ejemplo,
airports is more
ahí
effective as
sabemos
well, not just in
los
our
datos
airport here, but also in the airports of the United
esa es la
States.
forma que
But
nosotros
of course,
evaluamos
that
la
is the way
reacción
in which
de
we
los
have
pasajeros que
assessed
viajan con
the profile
productos
of
y a
those
través de
traveling
las
with
mediciones
products. Yes, the
encontramos
amount of
distintas
seizures, the
señales.
percentage, the type of seizures
Me
that have
parece que es
taken
una
place.
buena forma
I think that this is a good
de evaluar
way
la campaña.
to
No
deal
lo que
with
hace
this
al
campaign.
trabajo al
Not
riesgo
just the work
que esto
that
representa
we
para
do, but also the
para
risk that
otros
it
países
poses
latinoamericanos.
for the United States.
Gracias a ambas.
Thank you
Por el
both.
momento creo que queda bastante clara esta pregunta respondida. Y vamos ahora tenemos una
We will
pregunta para la doctora
now
Mati. Nos
we now have a
pregunta,
question for
doctora,
Dr.
¿cómo
Mati.
fue la interacción con otros
What was the
ministerios? ¿Qué
interaction with other
experiencia evaluó
ministries
República
throughout
Dominicana?
the
Y
experience of the
también
Dominican Republic? And
la otra
also,
persona nos pregunta
same
si
person is
puede
asking,
compartir la
if you can share the experience at the binational level, because Haiti has also had cases of ASF. In every crisis plan or emergency, it is essential to have a good relationship with all ministries because each one is responsible for one part of the process. The Ministry of Defense was key. The Ministry of Public Works was key in order to use teams in the field. So there was very good response from all the ministries. The president, like I said, immediately issued recommendations so that all the government levels would be involved to implement the actions to contain the propagation of the virus back then. So you're probably aware of the political situation in Haiti. And so we have engaged in communications with them as much as possible, but mostly our actions are focused on our country. Actually, some of the materials that were disseminated were developed in Creole so that they could be present in all the bordering provinces with Haiti so that we could deal with the areas that were more at risk in Creole.
Sí, muchísimas gracias, doctora. Continuando con
Thank
usted,
you very much, doctor. So there is another question
desde Ecuador,
from
que nos dice,
Ecuador,
que dice así, ¿qué
which reads as
porcentaje en el
follows. What is the
consumo de carne de
percentage,
cerdo descendió en el
what
país
percentage of
desde el fin de
consumption
semana
of pork
con la
meat
noticia del brote de
dropped? I
pertussis?
mean, what was the reduction
Entonces,
in consumption? What is the percentage of reduction of consumption of this type of meat after the campaign?
Well, I wouldn't dare to give you a figure in terms of quantity, but it was shocking for the first few days. The first, second months were really important after the disease was notified, but then trust was rebuilt and then people resumed purchasing and consuming swine products. The swine industry wasn't really that affected after the drop in consumption at the beginning. With the communication campaigns that I mentioned, we carried out where we resorted to artists and politicians and regular people who participated in the campaigns and created polls and videos for the networks. We really rebuilt the trust. And chicharrón or fried pork belly was one of the main characters of our campaigns.
En su
Perfect.
opinión, ¿cuáles son
Another
las
question.
principales
In
lecciones
your
aprendidas
opinion, what are the main three lessons learned when it comes to crisis communication in terms of African swine fever? What a great question. It is one thing to talk about things and then to actually deal with the reality. Well, what can I tell to my fellow countries? Well, you need to prepare ahead of time. We all believe that we will not be enduring that kind of situation, but we can be affected. Viruses have no borders. And it's important to strengthen the veterinary services. We need to have great internal communication within the services, and we need to define an emergency plan, an emergency response plan vis-a-vis a disease. That is fundamental. You need to start preparing that plan if you don't have it. And if you do have it, start drilling with it. Within that emergency response plan, you need to consider the communication plan. It is great to work during peace times. My recommendation is to work with the media outlets during peaceful times so that they can be your allies and the allies to the services when crisis hit. An educated press will know how to convey a proper message. That is fundamental. And also, I believe that once you have set up a crisis communication plan, when crisis comes, you need to have all the chain, all the links in the chain identified, the different target audiences as well. And when somebody asked at the beginning about the internal government services, it is important to define the roles and to create and build trust so that our higher authorities are certain that the country is ready to provide a response.
Excelente respuesta, doctora. Muchísimas
Great
gracias.
answer, doctor. Thank you so much.
Continuando con las preguntas,
Moving on with another question. Sylvia, there is a question for you here.
¿por qué
It says,
utilizaron tipografía
why did you use
rememora a Asia para sus materiales
fonts
publicitarios
that
y
reminds people of Asia for your publicity,
cuál
for
ha
your
sido la
campaign?
respuesta
Another question is,
del público u
what
audiencia?
was the acceptance level by the public or audience?
Gracias por la pregunta.
Thank you for that
Efectivamente,
question.
estoy totalmente de acuerdo
I
con la
fully agree
respuesta.
with the fact that
La
the
persona que
fonts are a reminder of
es
Asia, just like that person asked.
con la gente que estuvo
The
trabajando
communications
en los
with
distintos
the
diagramas
people who were in charge of the
fue un
different
poco difícil.
materials was quite hard
Nosotros queríamos
to maintain because what we
comunicar
wanted to convey was that the person needed to identify
gente que son que más
the
probablemente
target profiles, the profiles of people who were most likely to travel with swine products or by products.
una
I
abuela
asked
de más de
for
55 años
it to be a lady of over 57 years old who was traveling for tourism and traveling with a carry-on. And the first thing that they gave us was a man who had nothing to do with the Dominican Republic or anything of the sort.
lo único que pude conseguir fue
Eventually, all I could get was that image
lo que nosotros queríamos.
that was shown, and it wasn't really what we wanted. But I do agree that it is a mistake, and it is something that we can hopefully change in the future. When it comes to the result, I do believe that the result was quite positive. Lots of people are telling us that they heard the spot on the radio, that the radio spots are played at very specific times where people are listening or tuning into the radio, or when there are baseball matches. You know, baseball is huge in the Dominican Republic. It's similar to what a football or a soccer match is in Argentina, you know, playing advertisements in those kind of days. And many people listen to that. But we're honestly really wanting the travelers to listen to or to see our campaign. In terms of the effectiveness of the message, well, that happens and can be quantified by the products that are being confiscated in the ports or airports. As I said at the beginning, this is important. We believe that the Dominican Republic is more than likely the mechanism via which the African swine fever will reach our country. So we will continue to work on this. We will continue to disseminate the campaign, to make it more efficient, and to keep measuring the effectiveness of that campaign. And hopefully, we will be able to change the Asian font for a more Dominican font. It did not go unnoticed.
Bueno, esta pregunta va para el doctor Stefani.
This question will be addressed to Dr. Stefani. How willing have the countries in the region been in terms of arranging crisis management teams? Do you have specific examples of success stories when it comes to developing crisis management response people? Great question. In our experience, countries are quite willing to cooperate, to appoint people responsible in the different institutions when it comes to this communication. We initially organized a group of people. We trained these people, and in many of the countries, they have been constantly giving workshops and receiving training. Our most recent experience is related to avian influenza, and we were able to see that in some countries, actually in those countries where this disease was huge, they were able to effectively communicate materials with regards to the disease, and the veterinarian service really did a great job. So that is why we were able to work properly at an animal health level. Everyone did what they had to do at the right time. So they were able to remove the disease or eliminate the disease in some areas. So countries are quite willing to cooperate and are working quite actively in this subject, considering the fact that the region is also facing ASF and avian influenza. So they are quite active right now. Thank you so much. There are several comments that participants have written, great ideas for communication, for example. I don't think this question or comment is not addressed to anyone in particular, so any of the experts can actually respond. This is a question by Victor Góngora from Belize. It says, what role does compensation play in crisis communication as the desired behavior change impacts the pocket rather than personal health in non-zoonotic transboundary animal disease outbreak? Silvia, go ahead. Well, compensation is important, considering the fact that what we try to do is to promote the reporting of disease. The more cases of disease being reported, then the easier is to define the focus and the perifocus of the disease. And then it is possible to estimate the number of animals affected. If there is a compensation mechanism, then we need to promote it to incentivize reporting of diseases. In the case of the Dominican Republic, we are working with a compensation system or scheme that is implemented via ICA. And the compensation that we give, well, we try to keep up with the market prices so that the compensation is fair. But the thing is, as compensations are given, they can still be adjusted so that the system is more controlled. For example, one of the compensation requirements could be the presence of biosafety, or the participation in a special surveillance mechanism.
La compensación, lo que es muy importante es que exista esta comunicación.
But it is very important for the communication to exist in terms of why there are compensations and what are the advantages for farmers should they have deceased animals, then they need to report it. And there should be a strategy promoting this reporting. Compensations would be part of the reason behind it. I don't know if I answered the question. I think so. I don't know if anyone else wants to add something to that. Good. Okay, thank you. This would be then the final question because we are out of time. There are many comments congratulating everyone on their presentation, the presentation of Leticia, your experience on crisis communication, Dr. Silvia, congratulations on your resume and your experience. In Latin America, we deeply need animal health professionals with crisis management knowledge and risk analysts, health analysts to help communicate crisis. Gabriela is reminding us of the CVP, the regional/national strategy of risk communication that the CVP has. So we do have regional strategies or multi-country strategies in risk communication. These were some of the comments that we had during our session today. So thank you so much to our 4 panel members. All your presentations were fantastic. All your responses were great, and your experience in crisis communication is valuable. As we know, we need to prepare. We need to prepare for everything. We not only need to be reactive when a crisis comes, but we need to prepare in times of peace. Thank you to the interagency group. We're always getting together and preparing the topics that we want to show you when it comes to emergency risk communication and preparedness. The whole ICA team who's behind the scenes in the organization of these webinars. Rocio, you said you wanted to say something before we go. Remember, all these webinars are hosted in social media. You can disseminate them, circulate them, and please visit the link on the African swine fever. We have everything there. All the information is there. The interagency group has developed that website. We can put it in the chat so that you can go all to the website. Rocio, I don't know if you had something else to say. Go ahead. I just wanted to remind the audience that we will continue with these webinars as part of the IEFTAS project. There are upcoming topics. We will be preparing for the operation manuals. We've seen everything that needs to be done to prepare emergency plan and programs. And the following and the future webinars will be guided towards developing procedural operational manuals for emergency response. And this will be happening starting on June and for the remainder of the year. So please keep working with the GFTATs and with every agency that is a part of this interagency group. Dr. Martinez, perhaps you want to add something else, but thank you everyone for your participation. The presentations were amazing. Thank you so much for your work. I just wanted to congratulate everyone. Thank you, Leticia, for being a part of this. Silvia Kreindel, it was a pleasure meeting you. Welcome, and thank you for being here, willing to participate. And the Dominican team, thank you. You're always assisting us. Have a good day. Thank you all. As Rocio said, remember that on April the 25th, we will have our next webinar on zoosanitary education. So circulate that information, promote it. We want all of the agencies to be present, both official, private, investigation agencies, the academia. We want everyone to be present. This is a huge interagency effort, and we want you to be prepared. Thank you. You have a good night.
Gracias a todos.
Have a great week.
Hello.